Hey everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to show you a Thermage procedure. So Thermage is one of our, I would say, one of the first technologies that we brought into our office back in 2001, and it was super exciting at that time because it was the first non-invasive technology that helped to tighten the skin. So there's absolutely no recovery time, just a little bit of pinkness afterwards, and it helps to remodel that collagen under the skin and helps to lift areas such as the brows, the cheeks. We can also get some really nice tightening in the chin and neck areas, and we can treat other parts of the bodies too, such as the thighs, the arms, and the belly areas. So they all respond very well. Now, Thermage has gone through quite an evolution over time, and initially we just had a single type of tip that took forever to fire, but now the technology has improved. It's a much faster procedure, and we have tips for various parts of the body. So for example, on the body areas such as the stomach and thighs and larger areas, we use a tip that has a bigger footprint, and we get much more volumetric heating, which has helped to improve the results quite substantially. On the face, we use a little smaller tip, and then we have a super small tip for the eyelid area that is just absolutely fantastic. In fact, those are probably my two favorite areas to treat with Thermage, because I think we get phenomenal results, are the eyelids and body areas such as stomach and arms and thighs. And the face does really well too. We have other technologies for skin tightening in the office, such as Ultherapy, which also work absolutely beautifully for lifting the skin on the face. In this case, our patient also has cystic acne. And one of the things that were found originally in patients who were getting Thermage procedures is that if they had cystic acne, their cystic acne was also going away. So when they looked at the skin histologically, they found that not only was it stimulating collagen and helping to improve the skin overall, but it was actually shrinking those sebaceous glands. So now it's become a really great procedure for us to be able to offer patients who are suffering with cystic acne, because it can potentially cure it almost like Accutane would, but without having to take that oral medication and having the potential side effects from having to take Accutane. So fairly simple procedure. It's non-invasive. It does hurt a little bit. I mean, I don't know. I think all of our procedures hurt a little bit, some more than others. Some are painless, actually. It's not like we don't have any painless procedures. You know, you can always get an M-sculpt and it's perfectly painless, or Vanquish. But this one has a bit of a heat sensation with each pulse. But there's really no discomfort afterwards at all, you know, with each pulse. And then most patients will see a good result even after one treatment. Some patients may require a second treatment to really like kill those sebaceous follicles, but you know, we're really hoping for good results here. So we'll see what it does. If nothing else, you get nice skin tightening.
Yes, exactly.
So we've got our grounding pad attached to our patient because this is a monopolar radiofrequency technology, so it requires a grounding pad. With radiofrequency procedures, you want to make sure that you don't have a defibrillator or a pacemaker, and that you're not pregnant at the time of the procedure or anything like that. We also can't do the procedure over a metal implant. Go ahead and treat the jawline area because she's getting quite a bit of cystic acne in this entire area, and we'll kind of adjust the settings based on how this feels to you, okay? So with this procedure, we need to get patient feedback on a level of 0 to 5, with 5 being the worst pain. You should be at around, I would say like a 3 is a good level to be at. Okay? So right now it's just tuning. You may not have felt any of that.
I did not.
Okay, and we'll just start at a moderate level, and then we can adjust from there based on how it feels to you, okay? And what I'm doing is overlapping each pulse by about 50%, so we're getting good coverage. I like to keep going because I really like to build that volumetric heat. We have other monopolar radiofrequency technologies in the office as well. One of our other popular ones that we use a lot is called Exilis Ultra Plus, which has monopolar radiofrequency along with a little bit of ultrasound. And we use that a lot on the face, but also body areas to help contour, tighten, and also get rid of subcutaneous fat based on how we set the parameters. How are you doing so far? What would you say on a scale of 0 to 5 that you're feeling?
A 1.
A 1? Okay, so let's turn it up just a little.
Oh, Lord. I'm at 5.
We want you to feel it a little. You're too comfortable.
Yeah.
Can't have that. How is it now, or can you tell
It's like
you?
a 3, yeah.
It's a 3 now?
Yeah.
She's like, don't go up any higher,
Yeah,
please.
no, I can feel it. It's good.
It's good, it's good. If it gets too intense, we can turn it back down a bit, okay?
Okay.
So. But it's pretty tolerable, isn't it?
Yes.
Even at a 3?
It is.
Yeah. Yeah, the reason we want you to feel it is
Ooh,
because
that one I felt.
it probably, you know, is getting to the right level in the skin where we want that energy to go. Some areas of the face are also going to be a bit more sensitive than others. And I like to make a few passes over the same areas. We'll turn it down just a little.
Sorry.
No, you're good. And we're pretty close to where we are when we first began. A lot of patients get what we call a thermoglow after the procedure because it hydrates and rejuvenates the collagen and it just makes you look healthier. The goal is for our patients to wear less makeup and just feel confident the minute you wake up, right?
Yes. That's the goal.
That's the goal.